Sunscreens are used to protect the skin from the harmful effects of the sun. They help to prevent sunburn and premature aging, such as wrinkles and leathery skin. Sunscreens also help to decrease the risk of skin cancer and sunburn-like skin reactions caused by some medications. The active ingredients in sunscreens work by either absorbing the sun's ultraviolet, UV, radiation or by reflecting the radiation. It's important to note that wearing sunscreen does not mean you can stay out longer in the sun, as sunscreens cannot protect against all of the sun's radiation. There are various types of sunscreens available in many forms, such as cream, lotion, gel, stick, spray, and lip balm. See the notes section for information about selecting a sunscreen. When using sunscreen, it's important to follow the directions on the product package. Apply sunscreen generously to all exposed skin 30 minutes before sun exposure, using about 1 ounce, 30 grams, to cover your entire body. Reapply after swimming, sweating, or drying off with a towel, and if you're outside for long periods, reapply every 2 hours. If using the spray form, be cautious as it is flammable and avoid smoking or storing it near heat or open flame. When applying sunscreen to the face, be careful to avoid contact with the eyes, and if it gets in your eyes, rinse thoroughly with water. Use cautiously or avoid use on irritated skin. It's best not to use sunscreen on infants younger than 6 months unless directed by a doctor. In that case, it's best for infants to stay out of the sun and wear protective clothing when outdoors. If you develop a serious sunburn or think you may have a serious medical problem, seek medical help right away. Some sunscreen products may cause staining on clothing, especially those containing aminobenzoic acid or para-aminobenzoic acid/PABA. Certain ingredients in sunscreens can increase skin sensitivity. If you experience redness or irritation, wash off the sunscreen and discontinue use. Consult your doctor or pharmacist for an alternative sunscreen with different ingredients. If your doctor has prescribed this medication, they have determined that the benefits outweigh the risks of potential side effects. Most people using this medication do not experience serious side effects. While a severe allergic reaction to this medication is rare, seek immediate medical attention if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. In the U.S., call your doctor for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. If you have any allergies to sunscreen ingredients, anesthetic drugs, or sulfa drugs, make sure to consult with your doctor or pharmacist before using this oil-free moisture lotion. It's important to be aware of any potential allergic reactions or problems that may arise from the inactive ingredients in this product. Be sure to talk to your pharmacist for more information. Drug interactions can affect how your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. If this lotion is swallowed, it can be harmful and may cause serious symptoms such as passing out or trouble breathing. In case of an overdose, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. It is important to keep this lotion out of reach of children to prevent accidental ingestion. When it comes to protecting your skin from the sun, it's important to use a sunscreen that offers broad-spectrum coverage, meaning protection against both UVA and UVB radiation. Look for ingredients like avobenzone, octocrylene, titanium dioxide, zinc oxide, and benzophenones such as oxybenzone. Sun protection factor, SPF, is a key factor, with at least SPF 15 recommended, and SPF 30 providing high protection against sunburn. Water-resistant products can protect for up to 40 minutes of water activity or sweating, while very water-resistant products can protect for up to 80 minutes. Remember to reapply sunscreen as needed, especially when around water, sand, or snow, as they can reflect the sun's rays. Even on cloudy days, the sun's radiation is still present, so it's important to apply sunscreen and wear protective clothing when outdoors, and to avoid prolonged sun exposure, especially between 10 a.m. to 4 p.m. when the sun's radiation is strongest. When you're outside, it's important to apply sunscreen generously and frequently to protect your skin from the sun's harmful rays. This is especially important if you're using an oil-free moisture lotion, as it can help to keep your skin hydrated without adding extra oil. Remember to reapply sunscreen every couple of hours, or more often if you're sweating or swimming. And don't forget to cover all exposed skin, including your face, neck, and ears. This will help to ensure that you stay protected from the sun's damaging effects. When storing oil-free moisture lotion, make sure to keep it at room temperature and away from heat and light. Check the storage information on the package and do not use the product after the expiration date. If there is no expiration date, it's best to replace sunscreens every year as they may lose their effectiveness over time. Keep the lotion away from children and pets, and do not flush it down the toilet or pour it into a drain. Properly discard the product when it is expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.